celebrating a victory today on Kababayan, LA. It involves 69 of our Kababayan nurses who work for Delano Hospital, and they won a settlement, nearly $1 million landmark settlement case, and we're going to be talking about that right about now on Kababayan, LA. Joining us on the line is Manuela, one of the 69 victorious plaintiffs. And Manuela, hello and welcome to Kababayan, LA. You are on the air. Kamusta?
Fine. Salamat. Thank you.
Well, after winning, I'm sure you are fine. But before that, you've been fighting this in 2006 when you first filed the complaint. Ikaw yung isa sa mga umattend na mga mandatory meetings. You were forced to attend mandatory meetings. Anong sinabi ng CEO sa inyo?
Parang kaming tinatakot. Sabi niya na he's gonna put monitoring like a camera para ma-monitor daw if we speak our language, then we could be like, we can be suspended or terminated.
The crux of the case is hindi kayo pwedeng magsalita ng Tagalog maski sa inyo-inyo lang pag-uusap, maski during breaks, Manuela?
Ganon yun, yes.
Okay. And kamusta yung pagkatakot at paano kayo nagkaroon ng boses para magreklamo?
Mayroong nag-offer sa amin ng mga kasama na if we wanna join to sign the petition para mag-ano kami ng complaint kung anong ginawa sa amin. Kaya nagpirma ako.
All right. Thank you so much, Manuela. It did you good because now you're one of the 69 that's going to be receiving nearly $1 million in settlement, and more power to you. Congratulations for finding your voice. Attorney Carmina Ocampo of APALC and Christine Park Gonzalez of EEOC, you filed a complaint jointly and you help people in cases like this. Carmina, can you talk to us about the merits of this case?
Sure. Well, we filed this lawsuit with the EEOC, and it really, the lawsuit alleged that the hospital had committed discrimination based on national origin and harassment, and also that they failed to prevent discrimination and harassment against the Filipino American hospital staff, and that was a violation of civil rights laws.
Yes, let's talk about that, Christine. What can people learn about this? So, first, you can't be forced to speak English. Can you tell us about this a little bit and explain it to us?
Right. We're a federal agency that enforces laws against employment discrimination, and under federal law, an employer can have a language policy. However, the scope and the effect of the policy has to be within Title VII of the Civil Rights Act of 1964, meaning in this case, the policy went far beyond just not speaking English during work hours. It extended to break time, and it was only enforced with the Filipino-American workers.
Right. Did the hospital have anything to say about that? Why were the Filipino-American nurses discriminated against?
You know, we see that the EEOC can talk about this, but language policies, unfortunately, sometimes are just implemented by employers in a ways that, create divisiveness and mistrust. And an employer can have a language policy, but they are not allowed to just single out one ethnic group.
Right.
So the employer might have said that they received some sort of complaint about a Filipino nurse speaking their language, but that was no reason for them to single out the entire Filipino-American staff for these mandatory meetings.
And during their breaks, they can most definitely speak the language that they're comfortable using, but not everyone's happy about this. We talked about this case in 2010. We had people come in, some of the nurses, and we posted this on YouTube. There were some hateful comments as well. Some people are saying, well, you're in America, speak the language.
Mm-hmm. There are times when you speak a different language really helps. For example, when assisting a patient or a client. But in terms of using the language, the employer can regulate it during work hours as it relates to the business necessity. However, again, in this case, the scope went far beyond that. We were targeting one group into breaks, well beyond, for working reasons.
Right.
And I would just like to add that Filipino-American employees were harassed. I mean, one Filipino-American nurse, another coworker sprayed air freshener around her on her food because she hated the smell of Filipino food.
Oh,
our nurses were hardworking, loyal employees. They'd worked there for 10 years, 20 years. They spoke English, when necessary. They always spoke English to patients.
And they did their duties. They didn't deserve, nobody deserved to be harassed like that. Elnora is joining us on the line, one of the 69 victorious plaintiffs as well. Elnora, you were here on Kababayan, LA the last time. I sensed na before medyo kinakabahan. kinakabahan, may pagkatakot. Ngayon, nanalo na kayo. So, nakakahinga ka na ng maluwag?
Sure naman. Very.
In-imagine mo ba, in-expect mo ba na mananalo kayo parang David and Goliath na, mga nurses lumaban sa isang malaking ospital?
Sa palagay ko yung kaso namin talagang mananalo kami because of the extreme action that they have done against us.
And some of you guys are still working in the same hospital. Kamusta na ang environment dyan ngayon?
Sa ngayon, hindi ko masasabi dahil I have stopped working at there since 2008.
But thank you so much, Elnora. Congratulations to you. Please come back. 6 minutes not enough, so we have to talk about this in detail. But for now, thank you so much and congratulations to you. Thank you for joining us today on Kababayan LA. Sana po marami kayong natutunan. This has been Janelle Sawyer, Kababayan in Los Angeles. I'll see you again tomorrow.